Hey, this is Doc Gavin from Power Up Physical Therapy. We're going to go over a banded hip mobilization that's going to help open up all of the structures in the front of your hip. So this is useful for when you have, some tightness in your quads or your hip flexors, or even like if you've done like a lot of squatting and you have like that little pinching sensation in the front of your hip. So I'm going to take a medium to thicker band, standing at the rig. I'm going to put it to a height that's around hip height for me. So that's more or less hip height when I'm standing. The hip that I'm going to mobilize for today, we'll use my right leg. I'm going to step in with that leg, and I'm going to take this band and place it as high up into my hip crease as I can. So it's going to be way up there. If you feel like you're too high, you're probably doing it right. So I'm going to step back where I feel a decent amount of tension from that band pulling on my hip. I'm going to drop this knee down, the hip that I'm trying to mobilize, into this kneeling hip flexor stretch position. So a few components here. You already might feel the stretch in this position, but to do this properly, you're going to make sure that you're staying upright, good posture, and I'm going to tuck my pelvis and tighten up my abs, and I start to feel a little bit more in that quad and that hip flexor. I'm also going to tighten up my glutes, and I should feel that a little bit more. What I don't want to do is getting in this position here where I'm overly arched and I actually feel this less, even though I seem to be going a little bit more forward. All I'm doing if I do that is I'm just arching my back. I want to keep this purely in the hip and the quad. So once again, I'm in this position, good posture, tighten up my core, tighten my glutes, hold it here for a few seconds, and when I want to take the tension off, I'm just going to shift my butt back. To bring it back on, tighten up my core, my glutes, upright posture, take it off, shift my butt back. So hang out here for around a minute or two, and then once again, you want to make sure that you're not arching your back in this position. This is the banded hip mobility opener.